Hey everyone, welcome back to another virtual shadowing session. Today we have the amazing Dr. Judith Porter, Dean of Admissions at the University of Maryland School of Dentistry. We are so excited to have you and thank you so much for coming. So whenever you're ready, you can start.
Well, thank you. I'm not so sure that I am the amazing Dr. Porter, but I will do my best for you. So I'm just going to give you a kind of a taste of University of Maryland and let you know what we're about, what we believe in, what kinds of things are important to us. So I'm going to share first our vision and our purpose. And our vision is not just to achieve preeminence through excellence in these categories, but to maintain excellence. And our purpose is to advance oral health and thereby improve lives. If you don't know a lot about us, our city is kind of a happening place. There's lots of cool things to do. We have two professional ball teams, the Ravens and the Orioles. The Ravens almost made it to the Super Bowl this year, but not quite. That top right picture is a picture of the Inner Harbor at night. The Inner Harbor has all kinds of really cool things to do, including the National Aquarium. Bottom right is a picture of our Science Museum that is in the Inner Harbor area. And bottom left is Baltimore's Washington Monument in the Mount Vernon district of Baltimore. One thing about Baltimore is we are known for having almost any kind of ethnic food you can think of. And there is an Ethiopian restaurant in the Mount Vernon section of Baltimore. Ours is an urban campus, so there's not a lot of grass. Part of our campus is the Medical Center. We are a level 1 trauma center. People come from all over the world to observe and find out how shock trauma, our trauma center, saves so many lives. That top middle picture is Davidge Hall, which is the oldest medical classroom in the United States to be in constant use since 1807. And as you see, that's one of our patches of grass. Top right is Fayette Square, one of the two on-campus residency facilities. Fayette Square is 2 blocks east of the dental school. Bottom right is Health Sciences Library that is attached to the Student Center. And in the Student Center is our Fitness Center. It is the top 3 floors of the Student Center. So the swimming pool's on the 4th floor, which doesn't make a lot of sense to me, but not any of my business. The next floor is all machines, and the top floor is more open space, an indoor track, lots of space for intramural sports and classes. Every time a student from University of Maryland uses the fitness center, they swipe in with their ID card, and the school that you attend gets points for you using the fitness center. Typically, the dental school wins. We're smarter. When things get dicey, we don't go to the gym. Last year, we lost by 70 points, 70 out of like 7,000. So if you're thinking of coming to Maryland, this is one thing that we're going to stress. We want that Poe Cup back. We want that award back. So get to the fitness center. Lower left is a picture of Lexi, our campus support dog. Lexi makes the rounds of gatherings and meetings, and if you'd like Lexi to come to one of your functions, you fill out a little form online and she will show up. It reminds me to talk a little bit about the UMB police force. We have a very present police force on campus. Our campus is the safest place in Baltimore. Ours are not rent-a-cops. They are former state police. Most of them are former Marines. So in an inner city campus, if you're feeling a little squirrely about walking home because you've been studying until it's dark in the library, if you call them, they will walk you home or drive you home. And we have a shuttle that goes from campus to all the main areas of Baltimore. Our campus was founded in 1807 with the medical school. We are the founding campus of University of Maryland. And on the left, you see all of the professional schools represented. On the right, other areas of our campus, UMB Biopark, we rent space to private companies so that we can collaborate with them on research. The VA is on our campus, but it's a government facility. Many of their attendings teach at our university. We are also the home of the National Museum of Dentistry and are therefore affiliates of the Smithsonian Institution. Lots of different exhibits about teeth, taking care of the mouth, how the mouth relates to systemic health. An exhibit that's dedicated to Dr. Robert Tanner Freeman, the first African-American dentist to be licensed in the United States. Antique dental instruments, a couple of operatories set up so that you can see what it looked like at the turn of the century and how far we've come with a state-of-the-art operatory. And George Washington's teeth. George did have some gold teeth while the Smithsonian had the Museum of National Dentistry. The gold teeth walked, but we have the ivory ones, as well as some of the teeth that he had made from human teeth that he purchased in his lifetime. As you are probably aware, we are the first dental college in the world, not just the United States. Way back when, if you wanted to be a dentist, you'd hang with somebody else who said that's what they were, learn everything they had to teach you, and then you could go out and abuse the public just like they were. Along the way, people noticed that if you went to the dentist on Main Street, things seemed to go okay. If you went to the dentist on 3rd Street, maybe things didn't go as well. And it made people start to think about education, standardization, licensure. And we were the very first dental school to stand alone, independent of a medical school. And back then we were called Baltimore College of Dental Surgery. What our sign doesn't say exactly, but it kind of implies that we feel a great responsibility to the citizens of Maryland and the citizens of Baltimore. They're our patients and they're the reason we're here. So we do a lot of community service. Our building is 9 floors, lots of natural light, an atrium in the front of the building that goes from the 1st floor to the 9th. This is a picture of the 5th floor atrium that goes from the 5th floor to the 9th. It's an area for people to relax, study, have lunch, communicate with other people. Our building is organized in kind of a unique way. Foundation of everything we do is your education, and your classrooms are on the ground floor. The 1st floor is where our clinics of excellence are, where our faculty practice, where we run a referral service for dentists who have complicated cases they need help with. The 1st floor is also home to more of emergency situations, oral surgery, urgent care, radiology. 2nd and 3rd floors are where you will practice the art of dentistry you're learning Fourth floor is clinical for specialty clinics and graduate clinics. The fifth floor divides clinical from research. That's where the preclinical laboratories are. 6, 7, 8, and 9 are all research. Here is a list of the programs in our building. We have 3 dual degree programs, the DDS PhD, DDS Masters of Science in Clinical Research, DDS Masters in Public Health. These are considered to be the pathways toward academic dentistry. Our dental hygiene program is the only one in the state that offers a bachelor's degree. It also offers 2 master's degree programs. We have a residency program in general dentistry that can be either 1 or 2 years. And we offer residencies in all of the specialties, as well as a PhD program in oral pathology. Some stats about the class of 2024 that just started in August with pictures of the class of 2023, because for orientation, the class of 2024, we were social distancing and we couldn't take pictures. We had about 2,000 applicants. We enrolled 133, slightly more non-residents than residents, slightly more females than males. And then you see the statistics for GPA and DATs that are hovering around 21. I do want to call your attention to the statistic on the right-hand side. The class of 2024 was 21% underrepresented minorities. The class before them was 28% underrepresented minorities. Overall, all 4 classes, we are 24% underrepresented minorities. That makes us the most culturally diverse school, the 3rd most diverse school in the country. Meharry and Howard are first. They're both historically Black colleges and universities. After Meharry and Howard, we're next. We're very proud of it, and we work very hard to achieve these numbers because our patient population is extremely diverse, and we want to make sure that we're serving them best. We also want to ensure that we are able to educate you so that you are culturally competent when you leave us. Here are some statistics about the cultures in the first year class. We do this little project every year so that we can get a better feel and give you a better feel for what different cultures are represented besides just major ethnic groups. We also ask everyone to write down what languages do you speak. We had a gentleman come into urgent care one Monday morning when I was teaching, and he had nobody with him. He was by himself. He spoke no English. We were able to figure out that he spoke a Nigerian dialect, and we have a student that speaks that dialect. She came down from the clinic to translate, and it became an almost festive occasion. His face lit up because somebody finally understood him, and we were thrilled that we could communicate, find out what his problem was, and treat him. We continue to work a lot on our curriculum. Right now, we are doing a lot of virtual learning. We hope by this fall that we will be doing more face-to-face learning. We have customized the curriculum with the dual degree programs, as well as something we call the Diamond Scholars Program. We noticed that there were some people that were so good at time management that they were able to finish a majority of their clinical required experiences by the end of the 3rd year. So we invite these people to apply to the Diamond Scholars Program. We accept 4 to 6 people a year, and those 4 to 6 people spend their 4th year in the residency program of general dentistry, where they can see more people in a day with less supervision that they have earned by doing so much dentistry. We also changed from 4 general practices to 8 general practices. A general practice is an area of the clinic. It's also a mentoring group, a kind of home base. When we had 4 GPs, that meant that the general practice director had 60 people, 30 juniors and 30 seniors, to shepherd through the 2 clinical years. Now we have 8. So there are 15 juniors and 15 seniors. The GP directors can get to know them a little better, get to know their family of patients. And the GPs are vertically integrated because they also have 15 D1s and 15 D2s, so that you have a mentoring group, you have people to help you out. We also have a big brother, big sister program that a person can choose to participate in if they don't have to. The D2 president and vice president run this program and try to match people with a questionnaire about what are your likes and dislikes, hobbies, what area of the country you're from, things like that. All of our exams are taken electronically. In the regular school year that we hope to be returning to, we assign you to an exam room. And when you get to the room, laptops are already set out. You sit down at a laptop, log in, take the exam, and when you hit submit, you get your grade and feedback on everything that you've missed. Currently, since we're doing a lot of virtual learning, we are using a program called Proctorio that allows a student to take the examination from home in a secure environment while the instructor is proctoring the exam. Here's a picture of the simulation lab. We've tried to simulate it as closely as possible to the clinic so that you'd have an easy transition. 2 differences. One is that you'll have a patient in the clinic. In the sim lab, you have a mannequin. Another difference is the position of the monitor, which is off to the side in the clinic, where you will be entering all your patients' information into the electronic patient record. And in the sim lab, it's above the unit where you can pull up the criteria of the project you're working on that day or watch a live demonstration. We do practice comprehensive care. There are still some schools in the country that operate on a block system in the 3rd year. In a block system, you are assigned to operative block on Wednesday. And when you get there, you'd be introduced to someone who needs a restoration. We think it makes more sense to begin to simulate private practice as soon as possible. So we will assign 10 to 15 patients at the beginning of the junior year that you work up, develop treatment plans, approve the treatment plan with the patient and the general practice director, and then start that person's treatment from the first cleaning till the day you cement the last crown. You will probably end up with about 50 or 60 patients. None of these patients are ones that you have to get on your own. Every general practice has their own assistant director and director. They also have their own patient care coordinator. This is someone who receives information from screening every day. They know what all the new patients need. So when you need a new perio patient, you can go to them and they will help you find one. Every GP also has their own assistant and their own receptionist. This was our former clinic schedule and availability. Currently, we are not using this. This schedule reflects 10 clinic sessions a week. We now have 14 clinic sessions a week that allowed all of our seniors to graduate on time last year and will allow our seniors to graduate on time this year. Mondays and Wednesdays, there's an early morning, mid-morning, afternoon clinic. Tuesdays and Thursdays, mid-morning, afternoon, evening. And on Fridays, mid-morning and afternoon. We have enhanced HEPA filtration that is UV enhanced. Everyone working directly on patients wears an elastomeric mask and a face shield. IT also developed an algorithm for us that guarantees every junior has 6 reserved appointments a week. Every senior has 8 reserved appointments for them. And when you go into the software system, it's called Axiom. Most schools in the country still use it. You look for a specific day and time, and you're looking for a square in your GP that's yellow with your name on it. Yellow means that's reserved for you. If over the course of 4 weeks you can't find a patient to take that particular appointment, or your patient cancels, then you take the patient, tell the patient care coordinator, who turns the chair white, and anyone can have that chair. We have clerkships in the senior year. We're always adding new ones. Not everyone does a clerkship. One of the reasons is that clerkships require that you spend 2 clinic sessions a week in the clerkship. So you may not want to take that time away from clinic. You might do a clerkship because you want to gain more competence in an area for general practice, maybe like oral surgery. You might do a clerkship because that's the specialty you'd like to get into, like perio or prosthodontics, and you want to get to know the other residents, learn more about that specialty to make sure that's what you're going to do. Or you might do one for altruistic reasons, like domestic violence survivors. You will get clinical experience in all of the specialties anyway. A clerkship just makes sure that you get a more concentrated experience in that specialty. Oops, wrong way. We have 4 main areas of research: pain, oral cancer, microbiology and immunology, tissue engineering, where we're developing smart materials. We also offer summer research programs, the summer before the first year, the summer after the first year. We used to reserve that summer for studying for national boards part 1. Now that we have an integrated board, we can use that summer for other things like another research project, or you might want to participate with the global research community on campus that would allow you to go someplace globally with an interprofessional group and do a research project, like Israel, Peru, Brazil, Vietnam are some of the places, Africa. As I said before, we do a lot of community service. We do the typical things like Sealant Saturdays, Smiles for Success, Special Olympics. We do food drives. We pack bag lunches for the homeless community. We also have a very special relationship with the west side of Baltimore, where we do a specialized kind of community service and where we have developed something called the the UMB Cure Scholars Program. We identify 10 to 15 young people in 6th grade, people who are interested in science, who have an aptitude for science, and we begin to mentor them and tutor them. We bring them onto campus for 6 weeks of every summer so that they can spend a week in each one of the professional schools, learning what the profession is like, learning that this is something they can attain and take back to their community. We have 2 interprofessional education courses that you will take, one in your 1st year, one in your 3rd year. Interprofessional education is increasingly important because medical advancements are allowing us to live longer, but makes some people have much more complicated medical histories. So that you might be treating a patient that needs a team of people. So in the 1st and the 3rd year, you will be working with students from all the other professional schools on campus to solve scenarios written by faculty so that you can get an idea of how to collaborate with each other, what each profession brings to the table, what your gifts are as an oral health care professional. We require that every senior spends 2 weeks in one of our clinics that serve the underserved. I know you're aware of how important this is right now. With COVID, people who have lost their jobs. There are people who are struggling to put food on the table and keep a roof over their heads, people who don't have insurance. We have 2 clinics that serve the underserved right now in Westminster and in Frederick, and we are developing 3 more. Student life is extremely varied, as you can imagine, with all these different professional schools. We have a campus wellness letter, a campus wellness center that makes sure you're well taken care of. You can drop into a relaxation zone, drop in meditation, take meditation lessons, take deep breathing exercises and lessons on that. Our counseling center helps people with depression and anxiety. We want to make sure that you feel well supported while you're at University of Maryland. We have a variety of student organizations. These are the 3 main ones. You don't have to be Hispanic to be in the Hispanic group. You don't have to be African American to be in the NSDA. That was Chapter of the Year nationally last year. They won the Colgate Award for Community Service, and they won the Martin Luther King Award for Diversity. And these are the other student organizations that we have. At the bottom of the 2nd column, you see the Practice Management Club. This is a wonderful group of people that work to enhance the practice management course that you have in the 4th year. They bring in attorneys, practice management consultants, wealth managers, stockbrokers, people that can help you understand the business of dentistry once you're in practice. Here's a picture of Dr. Reynolds, our dean, and on graduation day. He is an extremely fair person who's so concerned about students, making sure that they are well taken care of. We're developing some new communication initiatives right now. He meets with student leaders once a month to find out how everything's going. How are we doing? Are there things that we can improve on? And he listens very carefully. On the left-hand side are reasons that people come to Maryland. Our commitment to diversity and outreach. We are still one of the most technologically advanced schools in the country. We have an international reputation for research. We are number 7 for NIH grants. Right now, we are soon to become number 4. Some of the unique educational opportunities like the dual degree programs and the Diamond Scholars Program. Our alumni are successful dentists. It's very important to us that you are clinically competent when you leave. Most residency programs love to get a University of Maryland student because they don't have to babysit you for a month before you get your sea legs. And that last thing, it's a very warm, supportive environment. Faculty have open door policies. Faculty want to know if you're struggling in a subject. We want you to go immediately to the course director if you start to struggle so that we can get you the tutoring and the mentoring that you need to be successful. So I've got some time for questions. Please fire away.
First of all, thank you so much for that amazing presentation. That was wonderful. And we do have some questions from our Instagram and YouTube. Okay, so during interviews, what qualities do you look for in the applicants that have come in for the interview?
Good communicators. It's vital that you be a good communicator to be a good dentist. A lot of people right now are used to texting. Me too. People aren't as comfortable making small talk. So we will watch for that during the interview, whether or not you can make a connection with the interviewers. We're also looking for people who are going to be good classmates. It's extremely important to us that we keep the environment that we have created so far. Right now, if somebody gets a good study guide, they give it to everybody. People take turns taking notes in classes, outlining the lectures, and then everybody gets that. So we want to maintain that.
Awesome. Do you have some advice or what are typical options for internationally trained dentists who want to come and practice in America? Is there kind of protocol for that?
There is a protocol. It's called advanced standing. We have our advanced standing program that requires that we have enough room in a class to have an extra student. We were able to take an advanced standing student about 3 years ago. Before that, it had been about 7 years because we have people coming in and out. Maybe somebody has a medical condition, they have to take a leave of absence, or somebody is doing one of the dual degree programs and they're coming back into the clinical part of the program. So it's been a while since we've been able to do an advanced standing.
Awesome. As far as an application goes from a holistic point of view, what are things that you or other people who are looking at applications look for as things that may help someone stand out?
Your personal statement's going to do that. And we like to see that you've had someone else read it for typos and grammar problems, but also make sure that it's tailored for the school that you're applying to. I read an application last year and the personal statement said, "I've always wanted to be a pharmacist." Well, they kind of forgot to tailor that to dental school. So we knew immediately. GPA and DAT scores will get you an interview. And those are the primary things. And like I said, those are the things we're looking for in the interview: a good communicator, somebody who can make a connection, somebody that has the personality qualities of a good healthcare professional, someone with integrity, empathy, caring. So those are the things we look for.
Awesome, thank you. So the next question is kind of catered towards recommendation letters and kind of the process that University of Maryland School of Dentistry looks at, and how much significance does committee letters have opposed to just regular letters of recommendation, if that makes sense.
The one thing about a committee letter is that typically you will have had a relationship with them for several years and they know you well. We accept a committee letter or a letter from a science professor that has known you well. In addition to that, we want to see a letter of recommendation from a dentist you have shadowed. All letters of recommendation have to be on letterhead, office stationery, university stationery, and they must be signed. If they're not, your application goes on hold and we write you and say, hey, wasn't a signature. Could you please get a signature? And then we don't consider your application until we get that back.
Awesome. So the next question is kind of focused on like the curriculum once you're in dental school. So as far as like the first year goes, like what kind of courses would students be typically taking before clinical?
Okay, so, and this is online. These are things that you can look at, like microbiology, gross anatomy, neurophysiology. It's an intense first year. And that's why we recommend too that these are some courses that you might be able to take, like anatomy and physiology in undergrad, that will give your brain a little break for 2 or 3 weeks in the first parts of those courses so that you recognize some of it. You'll be taking dental anatomy and occlusion first semester, operative dentistry second semester. And even though we have had a lot of virtual learning, we have still had one-on-one laboratories, more laboratories so that we can maintain physical distancing, but you still have to practice the art that you will be learning.
Awesome. So the next question has to do with kind of if a student is struggling in dental school, what kind of tutoring services does the university provide, and how does one go about getting those?
Like I said in the presentation, we want you to go immediately to the course director and say, I'm having trouble, I'm struggling with this. And the course director will find you a tutor. And that tutor is usually going to be an upperclassman, a dental student that did extremely well in that course. They're probably also going to be somebody who's getting paid by work study. But we'll make sure that we get you the tutoring that you need to have.
Awesome. So as far as somebody who's starting to write their personal statement, what would be some advice that you have for things to maybe stay away from and things that are like looked at, like that are good for a personal statement, if that makes sense?
I would think carefully about why you really want to be a dentist. It has to be about you. It has to be from your heart, from your gut. We read a lot of personal statements that say, yeah, I really like my orthodontist. That's why I want to be a dentist. Is that a good reason for you to be a dentist? Maybe you've looked at a lot of professions. And, for me personally, to be an MD, a family practice physician, would bore me to death. You get to spend about 10 minutes with each person. And sometimes, let's be honest, you're kind of guessing at what's wrong. You prescribed something, and if it works, you were right. In dentistry, we fix it. People come in with a problem, and we fix it. And we develop long-term relationships with the patient, with their kids, with the rest of their family. We spend maybe an hour with each person, and that's why we get to know them so well, and why you have to be a good communicator. Do you like working with your hands? Do you like to fix things? That's the cool part of dentistry.
Awesome.
And those are all sorts of things that you could put in your personal statement.
Perfect. Thank you. So the next question has to do with a gap year. And for a student who may be thinking of taking a gap year, what are some things that they could do or that may help them like excel prior to coming into dental school?
2 or 3 different things. First of all, we do not look negatively at all on someone taking a gap year, nor do we look negatively on someone who's reapplying. We could take 130 people out of 2,000. So some people will need to reapply, and we consider them specially. They've been persistent. This is what they really want. Gap year, it'd be cool if you could remain academically active, but a gap year could also be very valuable if you're a dental assistant. If you're doing something that causes you to relate to a lot of different people, so you're building your communication skills. And if you're a dental assistant, then you're also saving money for the first year of dental school, which is also kind of cool.
Awesome. Thank you. The next question has to kind of do with clinical requirements in dental school. So how does that kind of process work, and what are some of the requirements for graduation from dental school?
It's a point system. So, for instance, over the course of the junior and senior year, you need 1,860 points to graduate with a C in operative dentistry. You'll get a certain number of points for 1 surface restoration. You get more points for a 2 surface restoration. You get more points if you do it expertly, and the faculty doesn't have to sit down and help you. It's a point system in removable prosthodontics, that's partials and dentures. Also fixed prosthodontic bridges, implant restorations. And I think it's like 350 points you need in periodontics. So it's points, and that's based on the work that you're willing to put into it. Are you gonna review the procedure the day before? Maybe take some notes, put them on a 3x5 card. Make sure that you know what's going to happen next. Any faculty will bend over backwards to help you if they can tell you've done something to prepare. If you've never done it before, you've taken some notes, you've looked up the lecture for that, they're going to help you in any way they can.
Awesome, thank you. So the next question has to kind of do with the DAT. So in your presentation, you had mentioned that the average is 21, but for the university, is there like a certain number that must be met? And kind of going off of that, how is it looked at if somebody has taken the DAT more than once?
We need to see at least 18 in reading comprehension, academic average, and total science. And with total science, you could have an 18 if you had a 21 in organic, but a 16 in biology. We need each individual science to be at least a 17. There was another part to that. What was the second part to the question?
Just if somebody had taken a DAT more than once,
Okay.
is that okay? Yeah.
Not such a bad thing. And I have learned to think about this very differently because of the story I'm about to tell you. We had a young lady who applied 4 years in a row and finally achieved the DAT scores that we could consider as adequate. So we let her in. She was class president all 4 years, while she worked 20 hours a week at Express, and she finished early. She gave the commencement address for the university. Her essay was chosen for that. Let's see now, I think she's been in practice 6 years. She and her husband had all of their school loans paid off in 3, and they've opened another office. So what's that tell us about the DATs and taking them several times? You might do really well on the DATs because you take standardized tests well. I do. I think they're fun. Lots of people don't. And they struggle with that. So, we look at a holistic picture.
Awesome. Thank you. So the next question has to do with grade retake courses. So if somebody had taken a course and had to retake it, is that looked at very specifically, or is it okay to retake a course if need be?
It's okay to retake a course if need be. If it's one, not a big deal. If it's a bunch, that would make us worry. We see a lot of people that have had to retake organic chemistry. Personally, I totally understand that. That was a bear. And we only accept C or above. We can't accept a C minus. So if you have to retake it, not such a big deal. But if you have to retake many courses, or if you have withdrawn from a bunch of courses, it will make us worry. Because usually in undergrad, you're taking 16, 17 hours a semester. You'll take 26 in dental school. In undergrad, 16 hours means that you are physically in class 16 hours a week. In dental school, when you're not in class, you're in lab. It's a 9 to 4 day, 5 days a week. So it's a little intense. And we don't want to put anybody in a position where they're not going to succeed. We want you to succeed. So we're very careful about setting somebody up for failure.
Gotcha. Thank you. So the next question kind of has to do with research experience, like in undergrad, and how heavily is research experience looked at when applying to the University of Maryland?
It's cool. It means that you've worked a little bit more at time management. We don't require it. You don't have to have research. If it's something that you really like, that you enjoy, great. But we're also going to think the same thing about somebody who's in college sports, who's an RA, who has to devote a certain number of hours to something else each week. So your time management is good. We think you're probably going to do okay in dental school.
Awesome. So the next question has to do with kind of COVID, and obviously it's been really hard for students to get shadowing hours. And so some platforms like this are offering virtual shadowing hours, and some schools do accept it. Is UMD one of the schools that accept virtual shadowing hours? And how much emphasis is like being in COVID like looked at for the next application cycle? I hope that made sense.
We will accept up to 20 hours of virtual shadowing. We are still going to require 50 hours of in-person shadowing. Virtual shadowing doesn't give you as much of an accurate picture of what it's like to develop those relationships with patients that we talked about. You don't get to see the dentist's personality, how different personalities work. We were talking with an applicant last week who said 2 different shadowing experiences stood out. One was a guy who was very compassionate, a good communicator, cared deeply about his patients, did great work. The other guy did great work, not a great personality. And the difference between those two, those are the kinds of things that we want you to see firsthand.
Awesome, thank you. Within dental school, like a lot of students potentially want to open up a private practice after graduating. Is there any classes that are offered at the university or kind of connections that can be made to help with that?
We have a practice management course and a practice management student group. I will tell you though, that no matter how good the practice management course is, the greatest experience you will get is on the job experience. Working maybe as an associate for the first year and then branching out on your own, working as an associate and buying into that practice. There's a lot to know. And I don't think any school's practice management course can adequately prepare you for private practice.
Thank you. So next question, I think we have like time for 2 more questions, but the next one kind of has to.
I'm fine if you're fine.
Okay, awesome. So the next question kind of has to do with residency and well, I'll start with residency and the idea of like how the application process for residency works. Like, is there advisors that kind of guide students through that process? And yeah.
So on the registrar's site, so when you go to umaryland.edu, that's our campus. Dental.umaryland.edu is the dental school. If you go to umaryland.edu and go to the registrar's office, there is a section on residency, and it will tell you the things that you have to achieve to be able to get residency in Maryland. So it's all very well spelled out, and the registrar's office will help you with that. Like a Maryland driver's license. Did you pay taxes in Maryland last year? So almost everybody becomes a resident of Maryland in the second year of dental school.
Awesome, thank you.
Mm-hmm.
I guess this can be the last question because it'll be an hour, but just kind of like your last advice for anyone applying this cycle or the next cycle, just kind of the last thing you would possibly want to share with the pre-dental student.
If you don't know what your learning style is now, find it out. There's a bunch of questionnaires online that will help you discover your learning style. And that will tell you how you study best, how you process a lecture best. Learn time management now. Even if you have to take a course, even if you know, some people make out a calendar for the week. When I was in graduate school, I went back to school when I was 48. I graduated from dental school long before that. And I did a master's in secondary education and a PhD in higher ed administration. I worked in the office from 8:30 to 4:30. And then I went to classes from 6 to 9 and on weekends. So at the beginning of every semester, my girlfriend and I, who kind of kicked each other's butts through the program, we made a calendar that went on the wall. Here's when this paper is due. I want to have my first draft done at this point. We traded first drafts, and so that we had them all ready to hand out in time. That's the kind of time management you're going to need for dental school, because things, you get busy. And for me, if I see something shiny, I get distracted. So I need that kind of time management experience. Put yourself in lots of social situations where you have to make small talk with people. If you're uncomfortable doing that now, make sure you get comfortable doing that in the next year so that you can talk to anybody. You know, if you don't know Temple Grandin, it's a movie, Temple Grandin. Temple Grandin is probably the world's most successful autistic person. She taught herself 1,500 phrases that would help a conversation along. Go online, look up some of those things. How do you keep a conversation going? How do you make small talk with people? What do you remember from the first appointment to the second appointment? Hey, how's your dog? What's going on in your family? How is everybody? Those are 3 really important things that I would do. The other thing is start building your dexterity. There will be a question on the application. What do you do for dexterity? Please don't tell me that you were on the lacrosse team or the baseball team. That's eye-hand coordination. That's big stuff. You will learn in the first couple of months of dental school to be able to look at something and tell whether it's 1.2 or 1.5 millimeters. Those are the measurements you need to start working with now. Building scale models, building motherboards, embroidery, cross stitch, knitting, micropipetting, delicate things that require very fine motor movements with your fingers. That's what you're going to need. Mini sculptures. If you've ever heard of Sculpey or Fimo, making little animals out of this kind of plastic clay, and you bake it and it's permanent.
Amazing. Thank you so much for, first of all, the presentation, then the question and answer session, and such amazing advice. I just wanted to say,
it was amazing. Oh,
yeah,
yay.
yay, you were. Yes, absolutely. I'm sure all the viewers really loved having and seeing you here. So yeah, that's it for our session today. And if you have anything else to say, feel free. But yeah.
I had a wonderful time. Now, if you need to write and have questions answered, write to DDS admissions with an S on the end at umaryland.edu. And it will get to one of us and we will answer any of your questions.
Awesome.
And
Thank you.
best of luck if you're applying this year. I hope you're all successful.
Thank you.
Oh,
yeah,
one more thing.
Yes.
One more piece of advice for dental school. don't give up anything that you're passionate about. Whether that's, and learn how to manage your stress, not just by making a list, no, by going outside, taking a long walk, or cooking, or whatever is your passion, don't give that up. You need to maintain a balance, not just a work-study balance, but a balance inside your head between left brain and right brain. If you like to draw, great, or do some kind of art that lets you leave the left side of your brain and wander over to the right side that's artistic, where you can slip into neutral and relax. Now I'm finished.
No, thank you. No, we appreciate all the advice. Like personally, I need all the advice I can get. But thank you so much once again. And again, if anyone has questions, I'll like send the email like in the group me, so it's like easier for everyone to get. But yeah, once again, thank you so much. And
You're welcome.